Hi, my name is Marissa Munoz, and this is for Human Anatomy. And I'm doing my project over endometriosis and the reproductive system, and just the lack of knowledge about endometriosis and how to live with it and how to get diagnosed. So, to begin, the reproductive system is a collection of organs and glands that work together to produce offspring. So, on my slide right here, we have a ChatGPT picture of a woman's uterus. And so, as you can see, they had this marked as ovary. That is not correct. These are the woman's ovaries, the cervix opening, and the cervix canal. This is also not the fallopian tube. The fallopian tubes are up here. So yeah, this is the reproductive system. And endometriosis is a disease in which tissue, like the lining of the uterus, grows in other places of your body. Sometimes this can be called nodules, lesions, implants. A lot of the times, these are pockets of blood that are left over in your uterus, in your tubes. It's a chronic condition, which means it usually doesn't go away. There's also not a cure for it. 1 in 10 women deal with endometriosis. It's just pretty common. A lot of people just think that the symptoms that they have are normal. A lot of the symptoms are severe menstrual cramps, pain during or after intercourse, chronic pelvic pain, fatigue, nausea, bloating, bowel discomfort, and infertility. So on this slide, to get the diagnosis of endometriosis, you have to have a doctor go inside and actually see it, because it usually does not show up on MRIs. Sometimes it can, if the lesions are big enough, it can, but most of the time, you have to have a doctor that's willing to do an explorative laparoscopic surgery to confirm a diagnosis. So, this picture right here is of a cyst that was in my ovaries, and the red, I wonder if I can use a pointer. This redness right here is an endometriosis lesion. So this lining was attached to this big old cyst, and this was a cyst inside of my ovary. So this is the fallopian tube, and then my ovary should not look like this. They also found pools of blood inside. I had originally gone in for extreme pain, and they found like a 4 to 7 millimeter mass inside. And once she got in, they saw that on my diagnosis, my ultrasound is what I mean, my MRI, my ultrasounds. So when she got in, she actually, found the cyst and found that my uterus was full of endometriosis. So there's no cause. A lot of the factors are hormonal imbalances, immune system disorders. Usually takes 7 to 10 years for women to get a proper diagnosis, because a lot of doctors just don't care to really look much into it. So this is kind of part of the symptoms. Have you been told any of these symptoms were normal? Have you bleeding, painful ovulation, painful intercourse, extreme pain and discomfort throughout your cycle, mood swings and hormonal shifts, infertility, constipation? All of these things, a lot of doctors like to say are normal, and a lot of the times they're not. Women go throughout their lives having all these things, and they're just, told they're normal, and they just live with endometriosis and infertility because they don't have doctors that really care. So tips for living with endometriosis: heat therapy is great. Having a heat pack. I love a good bath. Gentle exercise, over-the-counter pain medication, laparoscopic removal of the endometriosis. It does help, but it will grow back. There's no cure. And a hysterectomy. Studies show that does help, but it's not really a cure, because then endometriosis can also grow in your bowels and bladder and everything else. So yeah, that is my informational about endometriosis. Thank you.